I'm going to be talking about what you need to do when you first come into Medicare. Not so much the what, but the when. So all you procrastinators out there, stay tuned because you don't want to be late for this one. My name is Keith Armbrecht, founder of Medicare on Video. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have videos on everything Medicare. So after this video, make sure to take a look at our Resource Center. You'll likely find everything that you need for Medicare. Now you can also get an immediate quote for your Medicare Supplement insurance. Just put in your basic information and you'll receive the rates and the plans that are available in your area. Now it would also be a great idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this video very helpful and please let me know if I can help. Okay, so let's now talk about your timelines and what you need to do when you're coming into Medicare. And really, this is when you're first coming into Medicare in one of two ways. Either you're turning 65 and you're going to be coming into Medicare, or maybe you're still working after 65 and your group plan is going to end when you retire, whether you're 68, 72, 78, doesn't matter. And then you're going to come into Medicare. Works pretty much the same way as when you're turning 65, but there are some specific things that you need to do. And primarily when you're turning 65, and I've seen this recently more times than I should, and Medicare has some pretty hard lines on what the timing needs to be. So I'm going to show you exactly what that is so that you understand. So the long and the short of this story is don't wait. When you are in your window, get it done, get it over, get it finished well ahead of time, and that way you don't have to worry about things that may come up that may prevent you from doing something down the road. So here we have when you're turning 65. So this is the normal, I'd say probably 75% of the people enter Medicare right when they turn 65. So there's a couple different timelines you need to understand here. So first one, either you're automatically enrolled or you signed up before your 65th birthday month. Now, automatically enrolled, what that means is if you elected to take Social Security at age 62 or 63 or 64, whatever it may be, if you're already taking Social Security, then they're going to assume you're not working anymore. So they're going to enroll you into Medicare A and B come your 65th birthday. So that's an automatic enrollment. If you are not taking Social Security, you have to do something. So Part A is going to happen by itself. You don't have to worry about Part A. It's Part B that you have to worry about, and that's really what triggers everything is Part B. So in this scenario, when you automatically signed up before your 65th birthday or you did it yourself before your 65th birthday, it's going to start the first day of your birthday month. So if you were born on June 15th, right now 1953, then you turn 65 on June 15th, your Medicare is going to start on June 1st. So it's going to start on the first of your 65th birthday month. Now let's talk a little bit about signing up for Part B. It's really not hard. You just got to do it. So if you want, I've made a link to make it easier for you. You can do it online. You just go to www.startpartb.com and it's going to take you right to the Social Security webpage where you sign up online. And yes, you do it at Social Security. You don't do it at Medicare. So just use the link, startyourpartb.com. I made it myself. I don't want any other insurance agents out there using my link to help their clients, but actually I don't care. Go ahead and use my link and help your clients, and hopefully it'll help everybody get to where they need to be when they need to get there. So feel free to use it any way you like. Now, this one throws people for a loop if you're born on the first of the month. So automatically enrolled, sign up before the 65th, but your birthday falls on the first of the month. So let's say your birthday is June 1st. It's going to start the month before your 65th birthday month. So in that scenario, it's going to start on May 1st. So again, you need to understand that, especially if you're born on the 1st. You have to sign up ahead of time before it all happens, or else it's going to be a problem. And here is where the problem comes. So now you've already turned 65. Oops, I forgot to sign up for Medicare. What do I do? Well, during the first month that you turn 65. So let's say you waited until your birth month that you turn 65. Medicare is going to start 1 month after. So if you were June 15th and you waited till June 13th to go sign up, where it was supposed to start on June 1st, remember, it's going to now start on July 1st. So you've bumped yourself out of a month of Medicare coverage to July 1st. Now, if you were still June 15th and you have waited, oops, now it's July 3rd. I forgot to sign up for Medicare. You go sign up for Medicare. You can see here, 1 month after you turn 65, it's going to start 2 months after you sign up. So July, then it's going to be August, September. So now you're not going to get coverage until September because you waited really a little more than 2 weeks after you turn 65. You can see it gets worse here. If you wait 2 months, it's not going to start for 3 months after when you sign up. 3 months, it's going to start also 3 months after you sign up. That's significant if you need the coverage. I don't really understand the rationale on why they do it this way. Obviously, they want to incent people to sign up when they're supposed to sign up, but this does take it to an extreme if you missed your time period, and then it goes even farther than that. If you go past that period, then it's going to put you in what's called special election period. And what happens then is you can only do that between January and March. You have to make your decision, and then it becomes effective in July. So if you were supposed to start your Medicare in June or July and you have missed it all, you're not going to start it till next July. So bottom line, make sure we get this done. It's not hard to do. We just have to do it. Now let's talk a little bit about still working past the age 65. So this is different. Those people for a loop, you've been working at your company for however long, doesn't really matter. But if you have group insurance at work, and it has to be credible insurance coverage, so it's got to be real HMO, PPO type group insurance coverage, then no problem. The one thing you don't want to do in that scenario is start Part B until you're ready to retire. So make sure that if you're going to keep your group plan, that you do not start Part B until you retire. Because number one, it's going to cost you a monthly premium. Number two, it's going to take away some triggers that give you some rights when you come into Medicare. So make sure if you are going to continue working that you do not start your Part B until you're ready to stop. Now, when you are ready to stop, start your Part B. Start it as soon as you know when your coverage is going to end at work. Understand, you're going to need to provide credible proof of coverage. So if you work past 65 to age 70, 72, 70, whatever it may be, they're going to want to have a form from your employer, and I'm going to show you where to get that form in just a second, from your employer that shows you've had credible coverage. If you do not have that form, you're going to have a big penalty on your Part B. So number one, understand here, depends on where you work, but it's going to take time to get that form. So you have to ask for your form early so that you have it when you need it, and it's going to likely come from your HR department. Some HR departments are great, some HR departments aren't so great. So it depends on where you work. Do this as soon as you know you're going to retire. So we don't want a penalty on our Part B, and we want to make sure it goes as smoothly as possible. So if you know you're going to retire 2 months from now, do it then. Get your information, get it to Social Security, get your Medicare set up for when you're going to retire. Now, to get that form for credible coverage, pretty easy. You just go to my website, MedicareOnVideo.com. Up in the left-hand corner, you're going to see Resource Center. Hover over that, it's going to drop down, come down to Guides and Forms, and then it's going to bring you into Guides and Forms. And you will see the employer coverage form is right here. If you click on that, it'll download on your computer. You can email it to your HR department, ask them to please fill it out and get it back to you ASAP. But again, do it certainly weeks ahead of time, if not months ahead of time, so that you don't have any problem. And while you're here in the Guides and Forms, look around. There's some good stuff here. You can click on a discount prescription drug card. So download a discount prescription drug card right to your computer. Yours to have, no cost to it. You can also get a copy of my book. I have a book on Medicare that pretty much covers almost every piece of Medicare. So something nice to have on your computer that you can reference now or in the future. So go ahead and download on Medicare Made Clear, and you'll have that whether you put it on your iPad or your computer or whatever it may be. So whatever you find here that's helpful, I'm happy to provide it. And this is just an important thing. You want to get this stuff done so that you don't have problems. So it's so much easier to do it early than it is to do it late, and we don't have to worry about anything. So I hope you found this helpful, and if there's anything we can do, just give me a call, visit my website. We're happy to get you quotes on your Medicare supplement coverage, happy to help you figure every other piece out. So we'd be happy to help. So I hope you found this helpful, and have a great day.